All the best, Mannat. All the best, doctor.
Thank you.
Thank you.
डॉक्टर्स कहते हैं बीमारियों से हॉस्पिटलाइजेशन हेल्थी बच्चों में भी हो सकता है। वैक्सीनेशन से उन्हें कई गंभीर बीमारियों से लड़ने की इम्यूनिटी मिलती है, इसलिए उसे वैक्सीनेशन कार्ड का हर वैक्सीन वक्त से दीजिए। आपका एक फैसला आपके बच्चे की जिंदगी बदल सकता है। फैसला सही, जिंदगी सही।
Vaccinations play a crucial role for a healthy and disease-free childhood and development of your child. Here you could see Kareena Kapoor Khan also encouraging parents to ensure that children are up to date with their vaccination status beyond infancy. Hello everyone and welcome to today's live session brought to you by GSK and FirstCry Parenting. My name is Mannat and I'm the mother of a 6-year-old and co-founder of the YouTube channel Get Set Mom. On the occasion of the World Immunization Week, our focus today is going to be on a really important question. That is your 1-year plus child up to date with all of his or her vaccinations? And we have an eminent doctor joining us today for this discussion who is going to talk to us about this and also explain the importance of vaccinations and their benefits. Also, viewers, I know you all have been enjoying these sessions and your participation means so much to us. So like always, please start dropping in your questions in the comments so the doctors can answer all your queries. I would like to welcome Dr. Arunaloke Bhattacharya, the Senior Consulting Pediatrician at the ICH Hospital in Kolkata. Welcome, Doctor. We are so glad you could join us today.
Thank you.
So let's start off with the first question for the session, Doctor. This year, the theme for the World Immunization Week 2023 is the big catch-up. How do you associate with it?
See, by the term big catch-up, what we realize that catching up with the vaccines, that is vaccinating every individual, irrespective of age, with all the available vaccines that are against some diseases, that should be there. That should be administered to all the people, irrespective of age. Firstly, secondly, that vaccinating all the children who have missed the essential vaccines, especially during the COVID days, because we have seen that the last 2 years, the primary vaccination, the vaccination drive, they took a halt due to the COVID pandemic. So they should be administered with all the leftover vaccines that the vaccines they are scheduled to have, but they didn't got the vaccine due to the COVID. So they should be vaccinated with all the vaccines, of course. And the third and most important, that creating an infrastructure, including the primary health center, from where the vaccines can be delivered to the recipients, that the easy availability of the vaccines to every individual of this country, that is also very important. So big catch up, definitely the term big is very important in today's perspective after post-COVID, yes, of course.
Thank you for that, Doctor. You're absolutely right. There were so many children, so many parents who kept their children away from clinics during, the COVID pandemic, and vaccines essential vaccines took a huge backseat. So that is obviously a big catch up here, and to make sure that that delivery of all the essential vaccines to all children is done unhindered. Thank you for that, Doctor. Moving on to the next question here of our session. We're hearing this term vaccines a lot, and it may not be very familiar in terms of what they exactly are to most people. So let's start at the very beginning and understand what are vaccines exactly and how do they work.
See, the vaccines are nothing but we are admitting itself inside our body so that that body can start producing some chemicals called antibody, which will fight against that disease in future. So the very basic concept of this vaccine came from Edward Jenner. You know that he observed that some of the people, they are suffering from cowpox, and they are getting they are getting resistance against the deadly disease of smallpox. So then that is a deadly disease. So with that concept, that some amount of germ may be a chemical which will fight against the future. So now, from the days of Edward Jenner, we have isolated, the scientists have isolated, so that the side effects of basic concept of vaccines by the basic concept is that you introduced a very little amount of the germ so that it can produce antibody and protect the disease, protect from the disease in future.
Absolutely right, Doctor. That is, it's a great way, to train our bodies to understand what it is that, what disease may be oncoming, and to help them train to fight it. So vaccines are so essential in that regard, and that's exactly what you said, exactly what they are. Thank you for that. And now let's move on to the next question here. This is also something that we've seen happen in society in general around us. And in the first year of the child, the first year of their birth, our parents are very on point with vaccinations. You've seen that go forward, and it's pretty good. How essential is it to help those parents understand? How essential is it to vaccinate even after the first year? The job is not done in the first year itself.
Oh yes, there are certain diseases which is very much prevalent after first birthday. So that also those vaccines are also to be considered very seriously, because all the diseases are life-threatening especially in children, because the children are immunologically naive. So they start developing their immune process from birth to till 5 years of age. Till then, they are not very immunologically competent. So that is why the vaccination is very important during this age group. And if we consider the diseases that are quite prevalent, even after 1 year of age, are say several diseases like hepatitis A, the foodborne diseases. Whenever the child starts taking food from outside, the foodborne diseases, hepatitis A, typhoid, chicken pox is definitely a disease that has to be considered after 1 year of age. The influenza vaccine, and of course the dreadful meningococcal vaccine. All these vaccines are to be considered even after 1 year of age. And if we go beyond 1 to 5 years of age, there is a vaccine for cervical cancer. That is the HPV vaccine at 9 years of age. So there are several vaccines which will protect the children from the dreadful diseases even after 1 year. So those vaccines are also to be considered after 1 year of age. Yes, of course.
Thank you, Doctor. Like Doctor rightly said, the first year obviously is important. We all know that. But beyond that, the importance of vaccines does not wane, and it's something that you need to keep up with, and as parents, obviously keep in check and make sure that the child is being vaccinated on time. Consult your pediatrician always; they're always there to guide you in the same. Uh, so, with which let's go further into this a bit, doctor. You mentioned a few vaccines, beyond the first year, but let's go a little further and learn a bit more about them. So, what vaccines are recommended beyond a child's first year of life, and which diseases do they prevent against? Like a bit of a timeline of them.
Yeah, as I have mentioned, that the first dose of some of the vaccines are given after 1 year of age, uh, hepatitis A vaccine, like varicella or chicken pox vaccine. It can be given after 1 year of age. Maybe typhoid vaccine. These should even after 1 year of age. Third, like
Doctor,
ABMR vaccine after 1 year of age.
Dr. Arunaloke, sorry to interrupt you, but sometimes there seems to be a bit of a network issue when you're conversing. Would you like to switch to any other backup network or something? Because sometimes we lose you and then we lose important information we want to hear. Dr. Arunaloke, can you hear me?
Is there any network issue?
It's a little bit is still there. The video is still freezing a bit, and your voice is coming in spurts. It's not consistent. Oh, this seems.
Am I audible now?
Yes, you are audible.
Am I audible?
As of now, yes, a bit. The video is still. Oh, now it seems a little okay.
Am I audible right now?
Yes, you are, sir. Yes, you are. Yes,
Okay.
doctor.
Yes. So we were discussing about the vaccines beyond 1 year of age.
Yes, yes.
So the vaccines that can be given, that can be administered after 1 year of age is, the hepatitis A vaccines, the second dose, the chickenpox vaccine, the typhoid vaccines, and the influenza vaccines, which were not given. If they are not given below 1 year of age, they can be administered after 1 year of age. And of course, the meningococcal vaccine and the cervical cancer vaccine or HPV vaccine that is given after 9 years of age. But still, these are the vaccines that has to be considered after 1 year of age.
Thank you for that, doctor. So, there is, as like we are discussing again and again, there is a whole list of vaccines, even beyond the first year of a child's age, that as parents, you need to monitor, you need to make sure that your child is getting. Along with vaccines, doctor, we see that list of vaccines, and then suddenly we see the name of that vaccine and we see booster in front of it.
Yeah.
Now, what does a booster dose actually mean, and how does it benefit the child?
Well, boosting something means that you are reinforcing some force. That is, booster means you are reinforcing something. So,
Doctor, we seem to be facing a little bit of a network lag and issue again. Dr. Arunaloke, can you hear me? Because again, there's a little bit that you're frozen and there's a network lag. If you could just find a better network space. Doctor, alternatively, you can also disconnect and rejoin. That might improve the situation. Okay, we are going to wait for Dr. Arunaloke to come back to us, and he will rejoin in a little bit. So we'll just hang on. Viewers, stay with us. He's going to be back soon. Sometimes we all face these slightly technical difficulties, and we just have to cope with it a bit. And he shall be back. And there is a lot more information to give in this session, and a lot more questions. And there are your questions as well. So let's wait for him to join back so he can answer all of them. So let's just hang around here for a few minutes. He shall be back.
डॉक्टर्स कहते हैं बीमारियों से हॉस्पिटलाइजेशन हेल्थी बच्चों में भी हो सकता है। वैक्सीनेशन से उन्हें कई गंभीर बीमारियों से लड़ने की इम्यूनिटी मिलती है, इसलिए उसे वैक्सीनेशन कार्ड का हर वैक्सीन वक्त से दीजिए। आपका एक फैसला आपके बच्चे की जिंदगी बदल सकता है। फैसला सही, जिंदगी सही।
Sorry, there was disconnection. Am I audible right now?
Yes, doctor, you are audible. There we go.
Okay.
Yes, doctor. It's better, doctor.
Yeah.
Sorry, we have a
please.
few technical issues now and then, which is, we've all lived through this technological space, and this happens. These ups and downs happen. But we are back. We have a lot more information to give you this session. Thank you for joining back, doctor. Please continue. We were speaking about booster doses.
Yeah. So regarding the booster dose, as I have already told, that all the children, they are immunologically naive. So once you administer one vaccine, the protective efficacy of that vaccine may not be long lasting. So because as the children, they do not have the full potential of the immunity. So we may have to boost something or reinforce with some other vaccines at a particular age. Suppose at 1.5 years of age, at 5 years of age, there are several vaccines which has to be given multiple doses, but those doses are the boosting dose that has to be given to maintain the optimum efficacy of a vaccine. So there are several vaccines which may have booster doses. Yes.
Thank you, doctor. And sort of what are the various booster doses recommended above the first year age for children?
The booster dose that we have, that has to be given after 1 year of age is MMR vaccine at 15 months of age. That so-called triple antigen, now it's not triple antigen, it's a almost hexavalent vaccine that has the primary doses giving 3 doses at first year of age, and the booster dose has to be given within 15 to 18 years of age. And that again, it has to be boosted again at 5 years and 10 years of age, that you know. And maybe the second dose of hepatitis A may have a boosting effect. So there are several vaccines where the booster dose, the HIV vaccine, that has to be boosted upon, the polio vaccine, that has to be boosted upon at 1.5 years of age. So after 1 year of age, there are several vaccines where the booster dose has to be given. Yes.
Thank you for that, Doctor. We're gonna, hark back a little bit because we spoke about this about vaccination compliance, which is so necessary. So as the child grows up, as we said, vaccination takes a bit of a back seat. But what is your personal opinion and experience as well on vaccination compliance after the child's first birthday?
Yes. During the first year of life, the parents are very eager to get vaccinated. But as the children, they start developing and they start going to the school. Now the play school has started almost after 2 years of age. So as soon as they start going to the school, the priority of the vaccine, that takes a back seat. So the parents somehow are engaged with some uh, other important issues, and they forget the importance of the vaccines after 1 year of age. Definitely the compliance gets reduced after 1 year of age, but that should not be there. Otherwise the child won't be protected. Especially, one has to remember that as soon as the child goes to the school, the chances of exposure to different viruses and different diseases increases. So at that particular point of time, the child needs more protection, and parents should be more vigil about the vaccination.
That's such an important point you raised. I remember even when my daughter started play school, suddenly, especially during like certain months of the year, she would fall sick more often. And obviously it spreads like wildfire through play schools. It's the toys, it's the close proximity. There's so much that these little children are sharing.
Absolutely.
And then you'd always be like, oh, she was fine at home, everything was fine. Suddenly she went to school, she's falling sick. And this
Yes.
is exactly what you just pointed out and what you said. So it's so important to keep up, even, I mean, despite certain being vaccinated, you still see them, being
Yeah.
obviously falling sick, etc. So, and they're being protected also. So that's
Yeah.
something to keep in mind that, that is, and that they are doing the job of protecting them to make sure that they don't fall even sicker.
Absolutely.
That's a really good point. Thank you for that, Doctor. Moving on to the next question here. How important is timely vaccination? And in case any parent misses a scheduled vaccination, because there are so many occasions, times you just might, it's out of your hands. What can be done about the same?
See, the timely vaccination is very important because to get, again, I have told you that optimum protection from a vaccine that can be achieved if the vaccines are given at their scheduled time. Otherwise, the full potential of the vaccine cannot be utilized, so to say. So, timely vaccination is very important, and of course, the only stakeholder in this maintaining this time schedule is of course the parents. But
Yes.
what I feel that the schools and the companies, they should also uh, be can play their role in maintaining the vaccine schedule, especially the schools, because in the school also, the teachers, they frequently do a parent teacher meeting and all these things. If they remind that parents that your child should be vaccinated properly, then, which I feel that in India the schools are not that much that much aware, or that much uh, very much, they do not pay interest in the vaccination schedule. Of course, they are not taught for that reason, but they can maintain some sort of routine, and they can remind the parents that, well, your child is not vaccinated, like that. So school may play a very important role in maintaining this, reminding the parents. And of course the primary physician and the pediatricians, they play their own role, of course.
No, that's a good point because if schools usually at times have started asking for a vaccination chart from parents as well.
Yeah.
So especially as for the younger ones, when you play school, nursery, KG, and you're going through that, it's actually a good point. I mean, all they have to ask for is a copy of the vaccination chart, and they themselves can see. what vaccinations the children are up to date with, and it's helpful for all the children in the class
Absolutely.
because
Yes.
it's a necessary thing for everyone to be protected. So
Absolutely.
that's actually a good point because schools can play a bit of an enforcing role here, which can help parents understand and adhere to the vaccination compliance and timely compliance and help them because parents can get busy, so reminders will help as well. Thank you,
Absolutely.
Doctor. Moving on to the next question. A lot of people wonder how to keep track of vaccinations and everything. So we hear something called a vaccination card, and that's mentioned quite a bit. So what is a vaccination card and why is it important? And what should be done just in case the vaccination card is lost?
Yeah. Vaccination, that vaccination is important, that I've already told you. Everyone knows it, and every health that advisory board in individual country, WHO, CDC, they are coming up with a schedule, and with they are very much uh, very much rigid, or I would say uh, they are making their all the countries very much conscious. But the problem is that ultimate the stakeholder is the doctor and the parents. So a card has to be maintained, or a document has to be maintained. What I feel in my personal practice very frequently, that after 15 or 16 years, they have lost their card. And what happens, whenever they are going abroad for studies,
Yes.
they need that documentation. That even in our country, some of the premier institutes like IITs and Bangalore Indian Institute of Sciences, they also need that documentation of primary vaccinations. So the documentation is very important, and this becomes easier nowadays in these digital days, because previously there was only a hard copy or the paper card or like that. But right now, what is my advice, that whenever you whenever the parents are vaccinating a child, they should take a photograph of that child, maybe a selfie with that vaccinations, because nowadays parents are very much they are very much selfish, I would say. Every now and then they are taking selfies. So why don't they take a selfie with the vaccine card after each vaccination session? My idea is that digital vaccine card document will be there in the mobile. So if the hard copy is lost or lost forever, there can be the duplicate copy can be taken out. So we are taking about 5, 10, 15 selfies every day. Why not a selfie with a vaccine card after every vaccination session? So that will be there, and you discard the previous one after the second or third dose. You discard the first one and second one, so that the digital document remains there. And of course, pediatricians or the treating doctors, they have to play a role, but it's very difficult for them also to remember that what vaccine has been given. That is the responsibility of the parents, that these vaccines have been given, and that should be in a written document or a digital document. Otherwise it's very difficult. Nowadays there are so many vaccines there, so if you don't keep a record, it will be very difficult to recall that what vaccine has been given. So a digital copy should be there in the form of mobile or selfie like that.
Yeah. So, I mean, and I remember someone also suggesting, take a picture and let's say the mother sends it to the father or vice versa. So they both have a record, or
Yes.
you keep it backed up, you put it on the cloud. There's
Yes.
so many, we have access to so many ways to keep this record and to keep it safe, that there sometimes there really is no excuse. And you say, I can understand 30 years ago say that I can't find it, but now you can't say
Now
that.
yeah,
It's You're not allowed to say that, and your child will want a record. It's so essential for them,
absolutely.
so that's extremely important. We're going to move on to audience questions now, Doctor. I know a
Sure.
whole bunch of them already flowing in.
Yeah.
So let's start with the very first one from a parent here. I have got my child vaccinated with all the due vaccinations, but have missed the booster dose. Is that okay?
No, that is not okay. But you can give the booster dose whenever you have realized that you have missed some dose. You consult your doctor, and that booster can be given at any age. Whenever you recall that, well, I have missed it, that can be given. Better late than never.
So that is an important thing, parents to understand, that better late than never. That means even if
Absolutely,
you miss it, don't think you missed the bus. You can still catch it. Speak to
absolutely,
your pediatrician, get that vaccination, get that booster, because it's even if you get it late, but whatever time it may be that you realize, the fact is that you realize and you know that you
yeah,
need it, and it's very essential.
yes.
Then moving on to the next question, doctor. What are the signs of hepatitis in kids?
Hepatitis, sorry,
What are
what are
the
the signs of?
signs and symptoms of hepatitis in a
Okay.
child?
So hepatitis, this word means that the inflammation of the liver. So basically, it's a disease of the liver, and this hepatitis disease is caused by some viruses. There are several viruses that can cause hepatitis, and the worst part is that in hepatitis, viral hepatitis, there is no specific treatment for viral hepatitis, excepting a few cases. So this disease is absolutely has to be prevented rather than treated, because as we don't have that much of treatment option, so it has to be prevented. And the common symptoms of hepatitis is are, I would say, that loss of appetite, nausea, yellowish discoloration of the eyes, and urine. So these three are the common clinical features of hepatitis. That is nausea, loss of appetite, yellowish discoloration of eyes and urine, and maybe there is abdominal pain. And there are several signs, but these are the common symptoms of hepatitis, and it's a mostly uh, viral infection, and that can be prevented. At least there are two hepatitis that can be preventable hepatitis, that is hepatitis A and hepatitis B. The vaccines are available.
Thank you for that, doctor. Moving on to the next question here. What month do babies usually get influenza shots?
After 6 months of age. After 6 months of age, the flu shots are started, and it is a yearly vaccine. One has to remember that the vaccine has to be given every year. So, like that.
Just as a follow up to this as well, is there any indication or any particular time of the year that this vaccination is usually doled out to children?
Yeah, we as we are in the southern hemisphere, so there are certain strains that is dictated or that is guided by WHO, that your country needs this type of vaccine, and we give this vaccine accordingly. But mostly, many a times we have seen that the most of the times the strains are same in the for the southern and northern hemisphere. Whenever WHO comes up with a vaccine in a particular time of the year, the vaccine has to be given.
Thank you for that, doctor. The next question here, is it okay to delay my baby's vaccination by 2 days?
Yeah, of course, because the vaccination is not that emergency. So if you keep in mind that, well, this is my date of vaccination, you can give the vaccine within 2 weeks even. The 2 days doesn't matter really.
Thank you, doctor. What is PCV and what is the age limit for the child for the same, and when is this vaccine scheduled?
PCV stands for pneumococcal conjugate vaccine. That is a vaccine that is being given against pneumococcal diseases. As you know, that pneumococcus is the name of a bug that causes pneumonia and septicemia and brain infection and ear infection and whatnot. So that has to be given at 6 weeks of age. The first dose has to be started within 6 weeks of age. This vaccine is also given in the national immunization schedule, that is in the government setup. That is, this vaccine is also being given. So it has to be started at 6 weeks of age.
Thank you, doctor. What is the first vaccine that babies are given? This is a question from
Immediately after birth, the 3 vaccines are given. One is BCG on the left upper side of the arm. Another is the polio, that is an oral vaccine. Another is a hepatitis B that is given in the thigh. So the 3 vaccines are given within 24 hours of the birth.
And this is given, I remember in the hospital, this is administered
Yeah.
immediately.
Yeah.
Yes.
Yeah.
So the next question here, do vaccines affect a baby's health?
Not really. Not really. That, yes, affection in other way that boosts the health of the baby. So in a way that affects the health, but in a better way, in a better sense.
This was like a two-pronged question. Like, do they affect it this way or that way?
Yeah.
They help to protect the baby's health. I mean, that's
Absolutely.
you
Yes.
know, we would take it as. Next question here, doctor. My baby is having a binasal sinus. What can I do about it?
Can you repeat?
My baby is having I'll spell it for you. Binachal, a binasal sinus. What can I do
Sinus.
about it? A sinus.
Tylon,
Yeah, I guess like a sinus issue.
binadal, B-I-N-A.
Nachal.
Binaural sinus, S-I-N-U-S.
I mean, it just says that. I mean, I'm assuming the parent probably wants to also ask if their baby has a consistent, like a bit of a sinusitis issue or something.
No. See, there is really no absolute contraindication for any vaccine, that any disease condition, excepting if the child is severely immunosuppressed, or for any reason, maybe some congenital problem or having some immunosuppressant drug, then only some of the vaccines cannot be given. But otherwise, there is no contraindication for any vaccines in a true sense.
Moving on to the next question here, doctor. It's a slightly long one. The parent seems to be very concerned about this, and rightly so. Here, a parent says, please tell me how many doses of MMR are required to be given. In my baby's vaccination card, only 1 MMR dose is written, but the doctor is saying it should be 2. And also 2 rotavirus vaccines were given in my card, but he gave my daughter 3. This question comes from a working single mother who's unable to afford many of these repetitive vaccines, but she also wants her daughter to be protected. So could you please help and guide her as to the number of MMR vaccines that are required for a child, and also the rotavirus?
Okay, so the answer for MMR vaccine is that MMR vaccine is given in the in private sector. It is not being given in the government sector, and now the recommendation is 3 doses: 1 at 9 months of age, 1 at 15 months of age, and 1 at 5 years of age. But this, instead of giving MMR vaccine, one can go for MR vaccine, that is being included in the national immunization schedule, and that is being given in the government setup free of cost at 9 months, at 15 months. And recently, you know that there is a drive of MR vaccines till 5 years of age. So MR vaccine is given free of cost at government sector at 9 months and 15 months. And recently, there was a drive of MR vaccine till 5 years of age. So practically 3 doses has been given. For rotavirus vaccine, the recommendation is, of course, 3 doses, but it cannot be given beyond 8 months or 1 year of age. Beyond that, it is not required.
Thank you for that, doctor. Mommy, I hope that allays your concerns. The doctor has very nicely spelled out the number of doses, the times they need to be given, and the alternative as well in case this one is not working out for you. Moving on to the next question here. Please share the baby's vaccination schedule and some information about the influenza vaccination for my child. What is the schedule for the same, and at what time can it be given?
That I already mentioned, it should be started beyond 6 months of age. In the first year, the 2 doses has to be given at 4 to 6 weeks interval. After that, this is a yearly vaccine. It has to be given once a year. So that is the schedule.
Thank you, doctor. Moving on to the next one here. My baby has turned 3 years old. What vaccination information can you give me for my 3-year-old? What is required?
That depends what vaccine has been given. because otherwise I cannot spell that what vaccine has to be given. If there is no leftover vaccine within 3 years of age, I think the next vaccine will be the yearly influenza vaccine and one vaccine at 5 years of age, the booster dose. Otherwise, all the vaccines are given by 3 years of age.
So you heard,
Sorry.
bless you, doctor. So you heard that right, parents. So as the doctor spelled out, there are these particular vaccinations that could be given at this point of time. But the right person to also recheck for this would be your pediatrician.
Absolutely.
Who you need to go to with the vaccination card in hand, so they can recheck that and tell you what is required and what is covered. Moving on to the next question here. And this is exactly what we were talking about right now. Doctor, my baby vaccination card has been lost. What should I do now? And I know that the last vaccination was done in the month of June.
That's a very difficult question to answer, because neither of the, if anyone doesn't maintain that digital this card, or if that is not available with a primary physician, it is very difficult that what vaccines has to be are given. But what happens that if anyone has a practice of writing down the vaccine in the prescription as well as in the card, the card may be lost, but the prescription will be there. So the vaccination schedule can be retrieved from the prescription itself. So one can go through the prescriptions and they can see that what vaccine has been given. Otherwise, it is very difficult to assess that what vaccine has been given. That can only be answered by the primary physician or the primary pediatrician.
That's true. That's true. Because a lot of times, I mean, some of the pediatricians do also sometimes do keep a record, and they keep and the prescriptions are usually also fed into a record.
Yes.
So like for instance, my daughter's pediatrician also uses an additional app, which which is like a backup for things happening. So one way to access that information is to reach out to your doctor and your child's pediatrician, and they'll probably be able to furnish you with that information. But parents, again and again, like Dr. Arunaloke and I are highlighting, there are many ways to keep a record of your child's vaccination. Just click a photograph. It's the easiest thing to do, and it's in your phone, and send that photograph out to 3 family members if you have to.
Absolutely.
They have it in their record in case something happens. Moving on to the next question here, doctor. Is there fever and general weakness after vaccination in babies, and is that normal?
Not weakness or general weakness, that there is no weakness, but yes, some of the vaccines may cause a little bit of fever and malaise and the pain in the local site, but that is a very trivial symptom. I don't think there is no cause of worry about that reaction. That is a quite a common reaction, and only paracetamol will help. No other medicines are required, and that will go away within 72 hours.
Yeah, usually that's exactly what you're saying. That's what's recommended. A little dose of paracetamol helps to, just keep the child a little comfortable after, in case there is a bit of a reaction, a bit of a let's say fever or general tired.
Yeah.
Moving on to the next question here, doctor. Is there any extra vaccination that we need to ask the pediatrician for, other than the list provided by the hospital booklet, other than the list, I guess, in the vaccination card? Is there any other extra vaccination we need to reach out to our doctor for that is not mentioned in it?
See, we cannot give the vaccines arbitrarily. There is a definite guideline of the vaccines for a particular country. So, like typhoid and hepatitis A vaccines are not given in the European countries because they are they're foodborne diseases. So there are definite guidelines for the vaccines for a particular area or for the in the world or for a particular country, and the government or the body, in our case it's Indian Academy of Pediatrics, they maintain a chart or they maintain a guideline for vaccination. So one cannot go beyond that guideline, and the vaccines are not available also. So it's no question of going. There's some extra vaccines. All the vaccines are included in the schedule. So there is nothing called extra vaccines.
Thank you for that, doctor.
One may argue that there is a little difference between the national immunization schedule and the schedule maintained by Indian Academy of Pediatrics, because there are certain vaccines which is really something costly vaccines. So there are some vaccines, extra vaccines, but all the vaccines that are given, be it in the national immunization schedule, be it by the IAP schedule, all these vaccines are recommended by WHO.
Thank you for that, doctor. Moving on to the next question here. My daughter is 22 months old. We have given the OPV as per the birth card. My question here is, can we give polio drops to her as part of the state government polio drive as well? And how many times can she be given these polio drops before she's 5?
Okay, so I believe that the question is that whether one should go for a pulse polio or the national immunization scheduled day polio drive that has been given, that drive is taken in the state wise. Yes, that vaccine has to be given. Single word, that vaccine has to be given over and above the normal schedule. That vaccine has to be given, and it usually occurs twice a year, and that is really guided by, or that is the fixed by, that schedule is fixed by the state government or the India government. That, but twice a year the pulse polio drive is on, and that has to be given below 5 years of age.
So we're coming to the end of our session here, doctor. Any final takeaways from you? Any final advice you'd like to dispense out to the parents?
The vaccines to be given as much as possible. I do believe that some financial constraints may be there in some vaccines, but even I would say that this national immunization schedule, the vaccines that is being given in the national immunization schedule free of cost, is a tremendous effort by our government, and by doing this we have eradicated smallpox. We have eradicated the neonatal tetanus, the tetanus disease that is prevalent in newborn, and we are almost on the verge of eradicating polio. So really these vaccines can cause wonder. So one should vaccinate their babies, be it in the government sector, be it in the private sector. Go for the vaccines. That is a catch line.
Thank you for that, doctor. That was an absolutely great discussion, Dr. Arunaloke, and I'm sure the viewers agree. We managed to gain so much information from you. We are leaving here understanding so much more about vaccinations that are required post your child turning a year old, how they work, how they help our children, and also what to do in case a vaccination is missed. It was a pleasure having you here with us, and thank you for taking out the time for this. Viewers, if you have any further questions, please post them in the FirstCry Parenting Q&A panel, and the FirstCry team will respond like always. Till then, thank you GSK and FirstCry Parenting for organizing this session. And viewers, a big thank you to you all for logging in and joining us for today's discussion. See you all next time. Bye-bye.
डॉक्टर्स कहते हैं बीमारियों से हॉस्पिटलाइजेशन हेल्थी बच्चों में भी हो सकता है। वैक्सीनेशन से उन्हें कई गंभीर बीमारियों से लड़ने की इम्यूनिटी मिलती है, इसलिए उसे वैक्सीनेशन कार्ड का हर वैक्सीन वक्त से दीजिए। आपका एक फैसला आपके बच्चे की जिंदगी बदल सकता है। फैसला सही, जिंदगी सही।